Patients are being turned away every day due to a massive shortage of HIV, TB and other medication. Health workers say the impact of the medical stockouts is dire, especially for AIDS and TB patients. Any disruption to their treatment can lead to a collapse. Now, this could have obviously fatal consequences for their medical condition. The health department says the situation is under control. So just how severe are the drug stockouts? To discuss this, we have the Department of Health's Anban Pillay, Treatment Action Campaigns Andrew Mosane, and WIT's Reproductive Health and HIV Institute Professor Francois Venter. Very good to have you all with us.
Good evening.
Professor Venter, tell us what your experience is.
For the last few months, we've had a steadily increased number of reports, spontaneous reports to our drug stockouts project of HIV drugs predominantly, but also contraception, one of the less used TB drugs, but also a whole range of chronic medication. They've steadily got worse to the situation now where previously it was predominantly second and third line drugs that we were seeing stockouts around. And now we're seeing for the first time in the last few days, first-line patients being turned away in 4 different provinces.
Okay, before you carry on, explain to us the difference between first, second and third line.
So for an HIV patient, first line is what you would start off when you first have the virus and you first get diagnosed. You should be started on the same day in this country. If you fail that, you develop resistance, you would get on to second line. If you fail that, you would go on to third line. South Africa is the biggest program in the world.
Okay, so the stocks are running out. This has been happening, as you say, sort of intermittently over the years, but increasingly so over the last couple of months.
This project, which is a collaboration within civil society, was set up a couple of years ago when we had a similar problem. We were getting multiple reports that there were drug stockouts. It's been running along for the last few years. Just in the last few months, we've started to see this escalating problem at the moment.
And your experience, what are you seeing?
As a public health care user, as one of the patients in the public health, the situation is very dear. And from my view and the Stop Stockout view, we tried months ago, not a month ago, to alarm the National Department with the situation with regards to essential medicines stockouts in the public health. With the communication that we've been getting, in the previous communication, there hasn't been any openness, transparentness, and also admission of what is happening now.
Right, so you asking them and you're not getting what the answer is?
2 months ago, we alarmed the National Department with regards to drug stockouts, as the doctor has said. And we knew that if we allow one essential medicine to be out of stock in one facility, it's going to be a challenge for many people. I'm speaking here concerned about my grandmother who's epileptic, who has to take her medicine from the Northwest Province, which is one of the worst provinces that is having drug stockouts. If I was not an activist myself, I wouldn't have got my supply of medicines to this date. The challenge is that I have list of facilities here with me that can show you where are the stockouts and which drug is in short. We spoke to one of the direct relevant person in the National Department, trying to get a sense of what is it that the department is doing and what would be their plan with regards to the shortage. Jane, I just want to say this to you. I'm not here to be apologetic, and I'm not here to run any favor to the National Department. And I'm worried that the minister called in Anban to be the accounting officer in this regard. This is shameful for the minister not being here, because he needs to account to the public, and he needs to tell the people. Because Friday we had an interview on Power FM, and I was the relevant person to speak to the minister. Unfortunately, I was called in and connected, and the minister was called in after myself. I wanted the minister to account and admit to the public and the people who voted him in power to say, yes, I admit there is drug stockout, okay, and this is the turnaround strategy that we are bringing in to help the shortage of drug in the facilities.
Okay. Tell us about this crisis that is affecting the sector here.
Well, it's interesting that he sits here and tells us about the crisis now. He couldn't pick up the phone and tell me a month ago or 2 months ago. He called me on the 10th of October and said that he has problems with a particular product. We called him the next morning and said to him, give us the problems that you have. He's never called me before that. So to sit here now and blame the minister, who is not responsible for supplying drugs, the minister manages the health system as a leader.
Who's responsible then for this, what appears to be a crisis?
Well, I don't know about a crisis. A crisis means that you have a problem that is not fixable.
So you don't think this is a problem when people are not able to access medication?
Well, I mean, I don't know what evidence you have, but I sent your staff a lot of the information. We have 3.7 million patients who are currently taking the fixed-dose combination. They have no problem. We have about 107,000 patients who are taking a fixed-dose combination of lamivudine. Another about 135,000 patients who are taking a combination of abacavir and lamivudine. Those two products have a problem because there's a problem with the plant in China which is causing a global problem. We don't manufacture drugs, we have to purchase them. If there's a global problem, what do? So we managed to access it from another country and we brought the stock in. The stock has come in over the last 2 weeks, so clearly there will be sporadic shortages of stock. I would say that's about 10% of the facilities. So this list that he has, I don't know where the list is from, but it would help him to actually give us the list rather than keeping the list to himself, because he's not going to be able to make the drugs or supply them.
Can you respond to that?
My response to him, we spoke with the National Department of Health 2 months ago through Stop Stock Out project. We alarmed them that there's going to be a serious crisis coming. Through Stop Stock Out, there have been communication with Khadija, who happens to be the head of medicine, something access, whatever, in the National Department. My worry is that I'm speaking to somebody who's not responsible to be speaking to me in this panel.
Okay, whose side should we believe here?
So my difficulty with what Anban's saying is that accepting that there's a stock out of this, this manufacturing chemical that is a problem. We're seeing drugs that are not part of that problem. They're not part of it. It's dolutegravir, darunavir, all these drugs that are part of second line, abacavir, AZT, standalone products, which are not part of this, that we're getting these reports about. And we're getting first-hand reports. I accept the fact that there's lots and lots of drugs in the system, but they're not getting into patients' mouths. They're not getting to the clinics. What we're getting is coal-face workers. I get several phone calls a day now from families, from patients, they all know I'm in HIV, so they phone me directly. They WhatsApp me, they Facebook message me, and they tell me there's a problem at the ground. So my concern is the Department of Health released a statement this afternoon saying...
Do you have to turn people away? Do you have to...
My staff this afternoon were actually... patients were turned away from Central Johannesburg on first-line medication, which is we're not supposed to have a stock out of.
Okay, so you say first line that's obviously the crucial time, isn't it?
Well, look, second and third line are very important to the individual
patients. If you deal
patients.
the first line correctly,
but these patients were turned away and told to go to the private sector and buy their drugs, by the public sector clinics. So there is a problem that is occurring. We've been reporting this to the Department of Health on an almost daily basis for the last 2 or 3 months. I'm worried that somewhere between the left and the right, people are not communicating with each other within the department, because this has been steadily escalated and escalated. And it's only now that it gets into the media that suddenly everyone's taking it seriously. And it really does worry me that we have actually been following process. The drugs that are there are not about this Chinese production crisis. There are other drugs as well.
Okay, what about the other drugs that are missing?
The darunavir, which is a product that was a problem in dolutegravir, both of them are manufactured by a company called Aspen Pharmacare, which is here in South Africa. They had a problem for about 2 weeks, but in the time that they have a production problem for 2 weeks, there was sufficient stock in facilities. So I would really like to understand which facility didn't have stock, because at the point when they had a production problem, they said to us, we have this problem, but there's enough stock, we think we'll solve the problem. They've solved the problem now, actually. But what's surprising is that both these gentlemen have all my details. If one of my staff did not respond to them, why don't they call me?
Okay, so can you tell us that all the facilities that deal with these patients that should be, I mean, are they fully stocked now? Can people get what they want?
For the first-line treatment, for example, which Professor Fent is talking about, we have 5 million units of ARVs in our warehouse currently.
Is that fully stocked? I mean, can you deal with everybody?
Yes. We can deal with everybody. So if
we've got two such conflicting stories. Why do you think these
Can I say something
are
on what
saying
Anban is saying now? It is not my responsibility. My role as a civil society activist is to make sure that I monitor facilities. Immediately, if I find something wrong, I alert the National Department. I don't speak to Anban.
So have you handed that list to the National?
I have the list. We spoke to the National Department, like Dr. Fenter is saying, 2 months ago, making them aware for merely not ARVs, for contraceptives, for BCG, which is a very essential injection for newborn babies. It has been out of stock. We know it's a global crisis. But looking at the constitution of the country and what the government must be doing in making sure that they realize, promote, fulfill the realization of those rights, it is not the responsibility of communities to listen to what Anban is saying now. And it's very sad for me, for him to say, I have his contacts. There is a protocol you follow in the National Department. I just cannot jump from the ground and go to Anban. I just cannot jump from the ground and go to the minister.
But Anwar is saying that everything's fine.
There's nothing fine in the public health facilities.
Let's talk about BCG.
There is nothing fine in the healthcare.
BCG is a global problem. If you go onto the website of the UK NHS, you'll find right now that they have a problem. If you go to the website of the FDA, they'll tell you they have a problem. If you go to the German website, you'll find right now if you do it. Now, where does he want us to get the BCG from?
So everyone's got a problem.
Everyone's got a problem, but
Jane, can I ask Anban something?
BCG somewhere that I must.
Jane, can I ask Anban something?
So there is a problem.
Can I ask Anban something?
BCG, yes, it's a vaccine.
Can I
but
ask
if you
Anban
can't get it from a manufacturer, what do you do?
Jane,
Okay,
can I
but
ask?
it's not just vaccines. I mean, there's a whole list.
There's
of
Panado,
medication
there's Brufen.
that's missing. The ones that dealing with schizophrenia and other psychosis, for
Exactly.
example.
That's the truth.
Contraceptives,
Yes.
it's
Both oral and injectables are not available in the facilities. Can I say something? Let us wrap off BCG and talk about essential medicines. Do we have to pay to buy over the counter for Brufen? There are facilities that don't have Brufen. It's an essential medicine. There is an essential drug list booklet in every primary health care that gives a guide to facilities as to these are drugs that should be in the facility. If there is no diclofenac, if there is no Panado, which is an essential medicine, Anban shouldn't tell the people that there is drugs available. There isn't medicines in the facilities, and he needs to admit, and the minister must account to that, because taxpayers' money has been used uselessly. There is no proper planning. Supply chain management is killing the people. I'm going to give you an example of Limpopo. There are drugs in Limpopo doesn't have drug stockouts. It has drug shortages. Facilities don't have medicines because drugs are stored in their depots. They don't have human resource. There is no manpower. There are no cars to take medicines to the facilities because of their poor planning.
Problem. Are you seeing that as well? Is that?
I think it is. I think it's diverse. I think BCG is an international problem. I think my concern is this is not being communicated to patients. It's not being communicated to healthcare workers. I've had two provinces approach me for guidelines to manage different antiretroviral stockouts. Part of this is out of the bounds of the department's control. It's out, the BCG is a good example. But there are a lot of other things that are at least tell the healthcare workers what to do. You can't expect a nurse on the ground to know what to do in a complex antiretroviral shortage. So my plea is just to get the communication systems around this.
Okay,
with
talk
the
us through the health workers. What sort of position does it put them in if they, and also telling the patient, I'm sorry, I can't help you?
I think for patients and for healthcare workers, the problem is the frustration of, with ARVs, we've emphasized adherence to such a degree, which is saying, you must never forget your tablets, you must try and take them approximately every day at the same time. And then suddenly they walk through the door and the tablets aren't there. And they're told, you better make a plan, go to another clinic, come back. One woman was turned away 4 times last week on her first-line therapy. She's sharing tablets with her husband. These are the kind of we can sit here and talk about the politics of communication, but the reality of it is that people are being turned away from facilities with life-saving medication not available to them. I think we're all invested in the Department of Health being successful in this, but at the moment it feels a little bit to me like we're being shot as the messengers saying there is a problem. We don't always know what that problem is. We're civil society. We don't have the monitoring systems, but when you get dozens and dozens of phone calls and messages from patients and doctors and nurses saying, we're running out of medicines, we don't know what to do. That's a very bad space to be in as a health system.
And what is your concern if this is not addressed now? What's your...
You know what, Jane?
Rejection here.
What angers me is that the department is not coming up and admitting that there is drug stockout. That's the first point. The second point is we are here and willing to assist them. I sent Khadija from her department the whole lot of list as to where is drug stockout and what is the medicine that is short. You need to push and tell us, is the medicine there? It doesn't make sense to have procured medicines and medicines is sitting somewhere in the national department. We need medicines in the facilities and we need people to access these medicines. I want to assure you, Jane, I'm not fighting the department. I don't have a a clear relationship with the department as an activist. My relationship with Anban and the minister is lukewarm. If they do wrong, I call it a spade. I call a spade a spade.
Okay.
If they impress me, I will allow them to impress me.
Good.
And
right. So I think, you know, there clearly is a problem. And I would also think, I mean, other than the loss of life, the trauma that people must go through, it will ultimately cost you more when you've got to treat them.
Sure, yes.
So what's going to happen now? I mean, something's got to change.
No, but I think what needs to happen is they need to communicate with me
Okay,
and
they've
say we have these
communicated
problems.
with you now, so what's going to happen next?
Well, next is I'd like to have a look at that list. We'd like to investigate which facilities there are and get the stock to those facilities. Or issue a press statement to say there's actually those facilities have stock, because there were many occasions in which they gave us lists of facilities that don't have stock, and they had stock. There was even a program on ENCA where a patient was put on ENCA to say the patient didn't receive the ARVs. That patient was then found to actually have misled the ENCA, and actually we received an apology from ENCA because they put the patient up to actually say don't get drugs so that you can pretend
Okay,
as though
I think
the
what we're going
government
to do
has
in a couple of
stockouts.
months' time, we should all reconvene and check up on the status. But thank you, all three of you. We're going to have to move on. It's good to have all three of you. That was the Department of Health.
No, give me the list.
Anban Pillay, Treatment Action Campaigns, Andrew Mosani. They're talking. That's a good sign. The WITS Reproductive Health and HIV Institute Professor Francois Venter. Still ahead, has fake news infiltrated our media long before we could recognize it? Tonight with Jane Dutton.